Welcome to another edition of The Explainer. If you are a medical school hopeful staring down the barrel of the UCAT, you know exactly what the Situational Judgement Test, or SJT, actually is. But let's be honest, more importantly, you probably know the intense anxiety that comes with it. So for the next few minutes, consider me your personal mentor. I'm taking you under my wing, and together, we're going to use this explainer as your ultimate blueprint to conquer that test anxiety and completely master the SJT. Sound good? Let's get to it. Okay, let's dive into this. Picture this. What if your friend accidentally double books a vital study session and a mandatory family dinner? What is the most appropriate next move? Now, you might be wondering, why on earth are we starting with a family dinner and an explainer about a high-stakes medical entrance exam? Well, because everyday dilemmas just like this perfectly mimic clinical triage. The SJT isn't asking you to perform open-heart surgery, right? It's asking how you navigate conflicting priorities, time pressures, and human relationships. It is literally assessing your core behavioral instincts.
So let's talk about mastering situational judgment.
A lot of students tell me that the SJT feels, well, incredibly subjective. Kind of like it's just a frustrating guessing game of what the examiners want to hear. But today, we're going to demystify that subjective nature together, because there is actually a highly objective framework hidden right beneath the surface of these questions. By definition, the situational judgment test is a cognitive assessment evaluating your ability to understand, prioritize, and respond appropriately to real-world scenarios. Look at that carefully. There is zero mention of anatomy, no pharmacology, no complex medical jargon to memorize. I want to reassure you right now, this test is entirely about demonstrating your empathy, your professionalism, and your sound logic. You already have the basic tools you need to pass this. You just need to know how to apply them to the exam's format. And that brings us to what I like to call the everyday analogy. To really grasp those complex judgment calls that you're eventually going to be asked to make as a future doctor on the ward, we rely on relatable analogies. By using simple, real-life scenarios, we can easily demystify the exam. And this brilliantly illustrates the point. Let's compare two potential actions for our double-booked friend from earlier. Now, an inappropriate action would be simply ignoring the double booking and just hoping it resolves itself. We all know that's a recipe for disaster and hurt feelings for sure. A highly appropriate action, on the other hand, would be advising them to communicate early and prioritize their commitments. In the UCAT, just like in everyday life, proactive communication and clear prioritization are your absolute key behavioral metrics. Sweeping a problem under the rug, that is always going to score poorly. I really want you to truly internalize this concept. Think of the SJT not as a medical exam, but as a test of your everyday empathy and logic. I am telling you this as your mentor. You already possess the intuition needed to succeed. You really do. You just have to trust your gut on what makes a good, honest, and communicative person, and then cleanly map that logic right onto a clinical setting. Okay, so let's get into our step-by-step success strategy. Now that we've got the right mindset established, it's time to move from theory to practice. We need a reliable, repeatable method to tackle literally any scenario they throw at you on test day. So here are your 3 vital steps to diagnosing an SJT question. Step 1, identify the core problem. Ask yourself, is it a patient safety issue, a breach of confidentiality? Step 2, consider all perspectives. Think about the patient, the doctor, the rest of the medical team, and even wider hospital guidelines. And finally, step 3, rank the actions by appropriateness. I always advise my students to treat every single test question exactly like diagnosing a patient before prescribing a treatment. I mean, you wouldn't hand out medication without knowing the symptoms, right? So absolutely do not pick an answer without diagnosing the core ethical dilemma first. Moving right along, let's cover some highly actionable mentor tips. We've got the strategy down, but now I want to give you the specific rules of the road. These are actionable principles you can apply immediately to your prep sessions to start seeing those scores climb. So, the crucial point is, whenever you're evaluating a scenario, you must always prioritize safety first. Next up, maintain strict confidentiality. Always act within your limits, meaning, don't try to be a superhero if a senior doctor is required. Communicate openly, and critically, avoid making assumptions. If it isn't explicitly stated in the text, do not assume it happened. These right here are your essential clinical pillars. If an answer choice violates one of these, it is highly inappropriate. But if it supports them, you're well on the path to a highly appropriate response. And listen, if you take absolutely nothing else away from this explainer, remember rule number 1. The absolute number 1 priority across all UCAT SJT scenarios is always, without exception, patient safety and professional integrity. If a scenario involves a doctor showing up to work intoxicated or a patient in immediate danger, you skip the polite conversation and you escalate the issue immediately. Patient safety trumps everything else, period.
Now let's talk about the Applaa advantage.
Studying these principles in theory is one thing, but practicing them efficiently, that is another ballgame entirely. As your mentor, I highly recommend checking out Applaa. Now, what's really interesting about this slide is seeing exactly how Applaa gives you highly realistic exam-style scenarios paired with step-by-step logic breakdowns for every single question. Doing this consistently builds your pattern recognition and completely removes that frustrating feeling of subjectivity we talked about. You aren't just guessing blindly anymore. You're seeing exactly how the examiners want you to apply the logic. It's a real game changer. Essentially, Applaa transforms subjective guesswork into objective, measurable strategy. Think of me as your supportive mentor who is handing over the absolute best tool for the job. You wouldn't use a butter knife for a surgical incision, right? So don't use outdated static textbooks for a dynamic, logic-based exam. You need a tool that adapts and clearly explains the why behind every single answer. Let's move to our next section and see how this builds your action plan. We've covered the mindset, the step-by-step strategy, the core rules of the road, and the very best tool available to you. Now it is time to put this study plan into action with an immediate to-do list to keep this momentum high. First things first, download the Applaa app. Second, start your very first practice scenario right now while everything we just talked about is totally fresh in your mind. Third, and honestly most importantly, review your logic against the expert breakdowns provided in the app. Don't just look at whether you got the question right or wrong. Deeply analyze why you got it right or wrong. So, are you ready to master the SJT? Download Applaa today and accelerate your medical journey. It's time to stop letting test anxiety dictate your prep. Take control, use the right tools, and start building that objective winning strategy today. I want to leave you with a final, provocative thought to ponder as you begin your practice. What kind of doctor will you choose to be when faced with your first tough call? The SJT is just the beginning of your journey, but it's your very first chance to prove the kind of empathetic, logical, and safe professional you are destined to become. Trust your instincts, follow the framework we laid out, and go crush that exam.